This last video will describe the fifth and final domain, interprofessional collaborative practice. The fifth domain is defined by HRSA as shared responsibility and collaboration among healthcare professionals in the care of patients and populations with or at risk of oral disorders. The competencies for primary care providers in this domain are to 1, exchange meaningful information among healthcare providers to identify and implement appropriate high-quality care for the patients. 2, apply interprofessional practice principles that lead to the planning and delivery of patient-centered oral health. And 3, facilitate patient navigation in the whole oral health care delivery system through collaboration and communication and provide referrals. There are various opportunities for interprofessional collaboration. One of the primary areas for interprofessional collaboration is referral between medical and dental. In addition, there can be warm handoffs between the two departments. Departments are also encouraged to create opportunities where they can learn from each other. Primary care team members can shadow the dental team members, and the dental team members can shadow the primary care team. This allows the other team members to learn about the workflows of the other department and identify where oral health or primary care can be integrated. Another opportunity for interprofessional collaboration is through all team member meetings that include both primary care and dental team members. Team members can also review patient cases together. This is a good learning opportunity to share strategies and ideas to help improve the patient's health outcomes. And finally, the health centers should consider interprofessional training opportunities like all team meetings, joint webinars, etc. When it comes to referrals, documentation and tracking of referrals is critical. Ideally, the referral should be documented and tracked through the electronic medical or dental record. Warm handoffs are an opportunity to immediately get the patient connected to care. This is considered a type of referral and should also be tracked. If your electronic medical and dental record are not interoperable and electronic referrals are not possible, there are workarounds. One workaround option is to manually track the prenatal patients that are referred to the dental department through Excel spreadsheets. Another option is to utilize communication strategies when a patient needs an appointment, like sending secured emails and messages to the other department to follow up with the patient to schedule an appointment. The health center may also consider dedicated appointments for the prenatal primary care patients. This slide shows an example of an electronic referral within the electronic health record system. This slide is a screenshot of a dental clinic schedule. The fuchsia slots, or the slots in the black box, show dedicated appointments for patients referred from primary care. This allows the clinic to ensure that those patients are able to get in for an appointment quickly, and it also helps with being able to track these patients. Some things to consider: at what visit will you refer your patient to the dental department? One note, we recommend selecting one prenatal visit to start, and then this can be scaled up later. Picking one appointment will make a consistent workflow for your team members. 2, what is the workflow for referrals to the dental department? 3, how are referrals tracked and documented? Can your electronic medical records send referrals to the dental team, and are they able to see them? Are your referrals trackable? 4, who is responsible for scheduling dental appointments after the referral is given? This could be the dental department or the medical department if they have been trained on the dental clinic schedule. 5, what is the follow-up process for referrals? This includes determining who will be responsible for conducting follow-up to make sure the patients are scheduling and attending their appointments. And 6, what is the capacity of the dental clinic to see referred prenatal patients? Dental departments typically have about 27% the capacity of the medical department. It is important to consider that the capacity that the dental department has and strategies to help with this potential challenge. Dedicated appointments for prenatal primary care patients could help support this. There are 2 project measures for Domain 5. The first measure is the percentage of pregnant women who have received a referral during the first and/or second trimester visit by a primary care provider. The denominator is the total number of pregnant women seen for a specific visit during that reporting month. The numerator is the number of pregnant women with a documented referral during a specific visit by a primary care team member during that reporting month. The final measure is the percentage of pregnant women who received a referral for urgent needs during a first and or second trimester visit by a primary care team member. The denominator is the total number of pregnant women seen for a specific visit during the reporting month. The numerator is the total number of women with a documented referral for urgent needs during a specific visit by a primary care team member during the reporting month. The difference between these two measures is one is a general referral and the other is a referral for urgent needs. Thank you for watching the series of videos. For specific questions, feel free to reach out to your coach or your fellow project colleagues on the project listserv.